Hi there, my name is Heather. I am currently working for Lancaster General Penn Medicine as a practice manager. I manage several of their departments. With that, I'm responsible for the daily operations in those departments, making sure that the practices are running smoothly, and I track things such as call volumes, visit volumes, revenue generation, and costs to make sure that everything continues to run effectively and smoothly. I also make sure that I'm tracking the RVUs or relative value units for the providers in my practice. This is one of the ways that the organization measures how productive and efficient they are with doing the visits that they do on a daily basis. I then will take all of that information and report it out to my directors weekly and quarterly as needed. Currently, personally, about myself, I'm happily married to a wonderful guy named Jim. We live in Mannheim with our two sons who are 10 and 6, and our mini Bernedoodle named Truly. She's super cute. Here's a picture of her. So when I'm not busy with school and working full time and my family, I do like to spend a little bit of time outside if I can. I have a very moderate exposure to healthcare finance currently. I am responsible for doing the budget for my departments, making sure that the costs coming in or the costs going out and the revenue coming in align with the different budgeting buckets within the budget that I have. I currently am using a program called EPSI, which is what the organization uses to manage all of those types of things. From the consumer side, I'm responsible for helping with not only verifying the charges on the back end and ensuring that the claims are complete with all the appropriate information, such as supervising physicians if it's a PA or a CRNP who was doing those visits, or making sure that the diagnosis codes and procedure codes match if it falls into a claim edit that needs to be completed. So I'm responsible for all those types of things. And then I also speak with the patients if they have questions about their bill, making sure that they understand all of that as well. Because of those complexities, I have actually started to try to teach myself a little bit about billing and coding. So that's, I guess, another interesting thing about me. I'm trying to teach myself how to do that so that I can understand it better in order to be able to help patients find better resolution when they have those same questions. The opinion that I have regarding Chapter 3 has to do with value-based or pay-for-performance reimbursement. While I have seen the value in the organization about receiving incentives financially for making sure that their patients get those quality screenings done, we do things like managing the diabetic A1C numbers. We make sure that mammograms and colonoscopies are done. But my concern is really, while we're incentivizing those providers, I feel that sometimes those incentivizations are not also passed on to the patient. So while we're expecting the patient to manage their A1C with specific medications, or we're watching their hypertension or high blood pressure and expecting them to come in and have those appointments every 3 to 6 months, some patients can't afford that. So it's one of the things that I think with healthcare reform that they need to look at, that if they're incentivizing the providers to have the patients have these things done, they should also be sending some of that to the patients as well, to maybe help offset some of the costs of healthcare insurance and such things for them, so that it's a win-win for everyone involved. Thanks again for listening. I appreciate it, and I look forward to having this class with all of you.